Good morning. I'm Bevan Baker, City of Milwaukee Health Commissioner, and thank you for being here this morning. I'm joined by Milwaukee Fire Chief Doug Holton, Deputy Chief Weber, Assistant Chief Jones, Dr. Josh Swain, Chief Medical Officer of the Milwaukee Health Department, and Paul Beatrice, who is the Division Director for Disease Control and Environmental Health. Today is a very exciting and historic day in Milwaukee. It marks a lot of planning and work coming to culmination. The H1N1 vaccine has arrived. This is the #1 tool in our toolbox as we try to curb the spread of H1N1 and influenza infection in our community. We are one of many public and private providers statewide to receive a limited amount of H1N1 vaccine to be used for vaccination of public health workers, healthcare workers, and paramedics. This is our first line of defense. The community needs to be protected, and we need to protect paramedics and public health workers so that they can safely assist others who are ill or hospitalized. Healthcare workers and public health workers also run the risk of spreading H1N1 to other patients who are chronically ill and may suffer severe disease or complications from H1N1 infection. So vaccinating these workers puts them in a position to help us prepare for mass vaccination clinics later for the entire public. Vaccinating public health workers and healthcare workers comes at the recommendations of the Centers of Disease Control and Prevention and also the State of Wisconsin Division of Public Health as we respond to H1N1 in our communities. Additional vaccine will be made available in the coming weeks for the entire public. And we're joined today here at the Milwaukee Fire Department because they are a critical partner as the Milwaukee Health Department hopes to play a major role in implementation of a mass vaccination clinic that hasn't been seen in many, many years. 41 years since our last pandemic and 41 years since our last major response. Emergency medical technicians, paramedics will be administered vaccine, and then they will administer the vaccine to those who wish to receive it. The Milwaukee Health Department will be announcing public mass clinics and dates and locations later this week. And we hope to, as the vaccine gets on the ground in October, get those individuals who are in high-risk groups first. So I'll want to invite to the podium Fire Chief Doug Holton. And the Milwaukee Fire Department is an important partner in our efforts to scale a mass vaccination effort like many have never seen here in Milwaukee. So I want to thank Chief Holton for the partnership and the work behind the scenes. And I'll bring him to the podium right now. Chief Holton.
Thank you, Commissioner Baker. Good morning. The Milwaukee Fire Department is pleased to collaborate with the Milwaukee Health Department this year in administering H1N1 nasal spray vaccines. It is a proactive measure to shield our personnel and the public from coming in contact with the new virus. We are encouraging all of our first responders who fit the criteria to get vaccinated now as we are collectively providing an avenue for them to accomplish that. Our members respond to 150 EMS calls on average per day. Last year, we responded to approximately 54,000 EMS calls. As you can see, we came in contact with the public frequently. And it is very important that we are protected from this illness so we don't pass it on. And it allows our members to provide the best care available to Milwaukee residents. Receiving the H1N1 nasal spray vaccine is an effective way to protect yourself from catching this new virus. And I am happy to work alongside the Milwaukee Health Department in ensuring our frontline people and the public are safe this flu season. We at the Milwaukee Fire Department value our partnership with the Milwaukee Health Department, and we look forward to administering the vaccine to the masses. Thank you.
Thank you, Chief Holton. As I emphasize, every year it's important to get vaccinations against influenza, seasonal influenza, and now H1N1 novel influenza. Your loved ones will be safe if you get the vaccine. and you can prevent serious illness in your home. Simply put, vaccines are safe and vaccines work. And we want to make certain that this year, that the Milwaukee community is protected. So get your seasonal influenza and your H1N1 flu shot as soon as you're eligible. So I'd like to take a few questions now, and if anyone has questions, we'll take them. Yes.
Yeah, Commissioner, over the whole life of this, the H1 as well as the regular flu vaccines, how many doses do you anticipate you'll give throughout now and let's say November 1st? What are you poised to inoculate? How many doses?
Well, what we hope to do first today is to start getting healthcare workers, and paramedics, and public health workers vaccinated. We want to look at high-risk groups. We certainly want to look at children and pregnant women and those individuals who are at particular risk. But this will be a large mass vaccination scale like we have not seen many times before. There are over 100,000 kids in our area that could be eligible to receive this vaccine. We want to get them. We believe that the federal government has produced nearly, and will produce nearly 250 million doses. And we believe that Wisconsin will get its fair share. And therefore, we would hope that most individuals in the state who are eligible to get it will get it. So we would like to see the provider community reach most of the citizens of Milwaukee who are eligible. So we're talking hundreds of thousands of individuals uptaking this vaccine.
How soon will doctors' offices be receiving the vaccine, and what will the priority be? Will it be given out for high-risk groups first?
We would hope that doctors' office and private providers would follow the Centers for Disease Control guidelines, the same risk categories that we are. Many of those private providers already have vaccine today. They received it, and they're starting to inoculate their healthcare workers. And shortly thereafter, as a vaccine becomes available each week going forward, these healthcare institutions will make ready vaccine to their patients who they have relationships with.
So how much vaccine is actually in this area right now for whatever purposes, whether it's healthcare workers, paramedics, or the general public? Can you say how many doses are available right now?
We received a limited supply for public health workers and paramedics. The city of Milwaukee received 1,500 doses of the vaccine. The state of Wisconsin has shipped about 46,000 dosages of the intranasal vaccine for deployment for healthcare workers.
Statewide.
Statewide.
When you say that you've received a limited supply, will there be enough vaccine for everyone should the swine flu epidemic take off this season?
Well, that is the hope, and I think the planning has suggested that right now the mist is available, and that is from age 2 to 49, so it limits who can get it, but it's also the first wave of vaccine is for healthcare workers. We would hope that as the injectable becomes available, that more individuals will be able to get it, and that millions and millions of dosages will come online weekly. I think another 5 to 7 million doses will probably be shipped nationwide within the next week, and Wisconsin will get its fair allotment.
And the truth is that there's a lot of parents, especially, who are nervous about this vaccine. What do you say to people who aren't really certain that they want to vaccinate their children?
We would hope that every parent and every individual will consult their medical provider. What we can say is that this vaccine is developed and manufactured the same way as the regular seasonal influenza vaccine. And it is safe, and it does work. We would hope that individuals would seek out their local public health department and their providers to get more information. But for those parents who are skeptical, we will underscore again that this particular strand of influenza is primarily affecting younger populations, and kids are at risk. And if parents want to keep kids safe, they should utilize vaccine. It's the best weapon we have against H1N1.